Vote for climate health. I'll just repeat hello and welcome everyone. Welcome to our webinar called It's Go Time, Get Out the Vote for Climate and Health. And we're going to start in 1 minute to let everyone join. And if you like, write your name and location in the chat and maybe a few words on why you care about voting for health, if you like. And then as questions come up, please write them in the chat. We'll have time for these and also a discussion. And then to emphasize so there's no confusion, what we'll be discussing today is nonpartisan. And we'll send the recording, the links and action resources to everyone who registered. So don't worry about that. So yeah, so maybe we'll just go ahead. So Cynthia, you can go to the next. So welcome to our webinar. It's called It's Go Time, Get Out the Vote for Climate and Health. We're so glad you're here. You'll learn why our voices and votes matter more than you think, all from a nonpartisan perspective. And we know that you have all had some part working in climate and health, and with the election looming, it's make or break. We know we need to elect leaders who will take bold climate action. Many of us are asking what we as health professionals can do. That's why today we're going to talk about civic engagement and voting as a prescription for health and the climate crisis. Oops, Cynthia. Yeah, you can stay there. That's good. So to briefly review our agenda, first we'll hear from fellow physicians on the front line. Then Dr. Cynthia Mahoney will talk about why civic engagement belongs in healthcare and is the prescription we need. Dr. Bob Kitchen will discuss how to get out the health vote and use the resources that have been created. Then we return to Dr. Mahoney with actions to take now. And lastly, we'll have a bit of time for questions and discussion. So we're going to start with two descriptions from the front line to remind us why civic action is so important, why we care. And I'd like to introduce our first presenter, Dr. David Rand. He's an internist with a master's in public health who practices as a general medicine and oncology hospitalist in Vermont. He is passionate about environmental advocacy and serves on the steering committee of the Vermont Climate and Health Alliance.
Hi, it's a pleasure to be here with you all today. So as you heard, I live in Vermont. And when I moved here, I thought that we were immune from major climate disasters here. We don't live anywhere near oceans, and we're quite north. We're really near Canada here in Burlington, where I live. And that proved to be quite naive. And I also thought that as a hospital medicine doctor, I would be also immune from seeing climate-related issues. I really thought that was the realm of primary care physicians, and likewise, that also proved to be naive. So I'm just going to share a short story about a patient I took care of not long ago. And we'll call this patient June. It's not her real name, but she was a victim of the flooding that we had this summer. We've actually had extensive flooding in Vermont repeatedly in the last number of years. The floods were unprecedented. People in our capital city, Montpelier, were completely inundated, and many of them had to leave their homes that were ultimately ended up being completely destroyed by mold, mildew, and just the force of rushing water escaping from rivers. And our patient, or my patient, I met in the ICU. She was leaving the ICU, and she was a woman who had come to Vermont to become a granite carver. We used to have lots of granite mines in Vermont. And she was kind of a neglected artist who grew old here. And once her house, which contained all of her beloved carvings and artwork, was destroyed, she ended up being essentially moved from temporary hotel to temporary hotel. She didn't have her medicine with her. She didn't have her neighbors to sort of keep her moored and centered. And she really couldn't take care of herself. And she rapidly developed a UTI and ended up having sepsis and being very ill in the ICU, requiring vasopressors. And when I met her, the ICU team had, saved her life, as we all do in healthcare. But she had nowhere to go. Her lungs had been destroyed and she had no home. And despite her life being saved, I'm not sure how much life she had left to live. And so she was a victim of climate change. And I think everyone on this call really cares about the climate. And that's why we're all here, so that we can translate the illnesses that we see in our patients, from climate to action. And action only comes from civic engagement. And I'm here to join you to be civically engaged and to vote. Thank you.
Oh, thank you so much, Dr. Rand. Unfortunately, I think for a lot of people, those stories, unfortunately, but they stick a lot better than just seeing the numbers or seeing the news. I mean, I think we all read and heard about the floods in Vermont, but then to hear, how one person is affected so deeply is so thank you so much. And now we'll hear from Dr. Brian Drummond on video because he couldn't be here in person today. Dr. Drummond is a clinical professor of emergency medicine at the University of Arizona. As a Navy combat veteran who discovered his passion for preserving our planet on the island of Guam, he works on many aspects of sustainability at work, home, and in the community.
Hello, my name is Brian Drummond, and I'm an emergency physician in Tucson, Arizona, a prime location for all types of heat-related illnesses. Let me tell you the story of two patients that I recently saw. The first is a 45-year-old man who works as a framer. He's in the heat every day, and one day came to see me after falling off the ladder when he became dizzy and lost his balance. He sustained multiple rib fractures and a sprained shoulder, and now will be out of work for the next few weeks as these heal, limiting the income he brings into his family. The second patient is a 32-year-old female who came to see me after donating plasma and then having to walk 15 minutes to a bus stop where she waited for transportation back home. It was 105 degrees that day, and while at the bus stop, she passed out and was brought to us for a syncope evaluation. She was transported by EMS, and her workup did not require her to be hospitalized, but unfortunately, she now has a hospital and EMS bill to pay. These are only two of the patients that I've seen this summer with heat-related illnesses, but they also reflect the types of presentations in the emergency room that are not always captured, as one is a trauma patient, and the other one is a syncope evaluation. They are not the classic heat stroke or heat exhaustion, but they are victims nonetheless of extreme heat and weather. These and many other patients fill our overcrowded healthcare system and are totally preventable healthcare encounters. Seeing firsthand how climate is affecting my patients and health motivates me to become more active in both educating people and patients, as well as advocating for policies on these type of topics. Whether that involves helping with green infrastructure and rainwater retaining basin on our streets in Tucson, to helping register patients and medical staff to vote, to serving as an example for sustainable health practices in my department and hospital. Being active in these endeavors is highly rewarding. My colleagues tell me a story of their successes using sustainable practices or how they planted a tree over the weekend to help with shade in their own backyard. Even though the topic seems formidable and overwhelming, at times, if we break it down into simple parts, we can approach it and find ways that we can best engage and become part of the solution. It is the little steps that lead to big change, and each of us as health professionals need to use our voice to share not only the problem, but the solutions of how climate change is affecting our patients' health. Thank you for your time and engagement in climate health.
Super. And so thank you, Drs. Rand and Drummond. I think Dr. Drummond brings up that point that we all know, it all depends how you code something, how something is then goes into the data sets. Same thing with COVID, you know, but so many things. And I think a lot of things are undercounted and underrepresented. And one of our participants who just joined us, Jamie, I'm sorry, Duvernay, I don't know how to say her last name, but brings up a super good point that the people often who are impacted the worst by climate change are those actually who vote the least oftentimes and whose voice needs to be heard louder often than those who seem to have a loud voice. So that's a really good point. Thank you for putting that in bringing it to our attention. So now, Dr. Mahoney, wait, did I introduce you? Oh, no, where's my Dr. Mahoney? We'll talk about civic engagement, and why it belongs in healthcare and is the prescription we need. Sorry, now I lost your little bio, so maybe you can introduce yourself, Dr. Mahoney.
Sure. Thank you, Karina. And thanks so much to David and Brian. So I'm Cynthia Mahoney. I am a retired nephrologist living in San Francisco Bay Area and co-founder of Climate Health Now and Voting for Climate and Health. Also work with Citizens Climate Lobby Health Action Team, which kind of got me my start in this area. So let's go. So why civic engagement and get out the vote? I have to say that back in 2019, when we formed Climate Health Now, I certainly didn't expect that I'd be talking about voting in 2024. Yet it was obvious even then that the individual care we provide in our office is just no match for the health impacts of climate change. We needed to elect leaders who will take bold climate action. Even with that understanding, I was surprised when I saw this graphic that shows that the traditional healthcare we provide accounts for only 20% of our patients' health. The social and environmental determinants dominate health outcomes. And of course, that proportion will only increase as our climate health impacts accelerate. Upstream of those social determinants are what are sometimes called structural determinants, or sometimes lumped in with the social determinants. But chief among them is voting. As Daniel Dawes says, for every social determinant of health, there is an underlying policy, decision, or allocation of resources that enable those conditions to exist. And the strength of this relationship is shown here in the Healthy Democracy Index. Each of these little squares represents an individual state, like here's Wisconsin, here's Arizona, California's over here somewhere. And voting access is here on the x-axis with better health outcomes, a basket of 12 public health outcomes like premature mortality, infant mortality, chronic diseases. And you can see a striking relationship between voting access and better health. So we can take from that the laws and policies determine the conditions of our environment, as several people before me have said. The people we elect determine those policies. And as health professionals, we can use our influence both to advocate upstream with our electeds and policymakers, but also to encourage our patients to be informed voters for health. When patients are voters, health improves. And this creates a virtuous cycle where increased civic engagement leads to better policies, leads to better health, and people that can be more engaged. And this concept is now mainstream. The American Medical Association has recognized voting as a social determinant of health, and the California Medical Association did the same just last month. Healthy People 2030, the initiative of the Health and Human Services, has established voting as a key metric for 2030. And medical schools and societies are increasingly teaching advocacy and civic engagement because students want this, they demand this. So what can we as health professionals do? We can educate our patients and policymakers about these connections. We can promote civic engagement for ourselves, our colleagues, our organizations, and our patients. We can advocate with our leaders. We can integrate civic engagement into healthcare to make informed voters for health and amplify our voices by joining a health advocacy group. Because we conclude that civic engagement is a climate, health, and equity solution. Today, we're going to concentrate on the second one, promoting civic engagement. So what does all this mean for how we care for our patients? Well, including civic engagement in healthcare settings, not just for healthcare professionals, but right in our settings, is good healthcare. Why? Because we are trusted messengers with a unique connection to patients who are most likely to be harmed, yet often have few other civic connections and tend to be low propensity voters. And we have an obligation to provide anticipatory guidance on the greatest threat to their health, to connect the dots for patients between climate change and their health and their vote, and then facilitate them caring for their own health through voting. So just as we would prescribe insulin for a diabetic out of control, but also teach them about diet and exercise and how to monitor their blood sugar, we need to help inform our patients about the most important thing they can do, the most powerful thing they can do to improve their health long term. And in addition, point of care access right there when we're seeing people is highly effective, and it's easy to do with nonpartisan registration tools like VoteER. Now, some might say this is too political, but as Virchow pointed out, medicine is inherently political. So what we must do is remain nonpartisan while at the same time being advocates for our patients' health. And this is effective. This is one slide looking at turnout by race in new voters who were engaged by a variety of nonprofits. And they showed that voting engagement increased in everyone, but disproportionately more in people of color. And the graphs are almost exactly the same for youth and poverty. So when nonprofits talk to voters, it works, and it disproportionately increases voting among those who previously were least likely to vote and most harmed. And I've been asked to address this directly as well, because the first thing that people often think when they say, oh, civic engagement, yeah, it sounds great, but how can I do one more thing? Is that too much? Well, our Surgeon General, Vivek Murthy, a couple of years ago had an editorial in the New England Journal of Medicine about burnout. And he said quite clearly that it's really about the fundamental disconnect between what we can do and the mission to serve that motivates us, and the moral injury from being unable to provide the care that patients need. So that civic engagement can actually be an antidote. And VoteER gets quotes like these from people, like the emergency doc in Ohio who said, I'm continually energized when talking to patients about this. It's been good for my own mental health. And when we integrate civic engagement into healthcare settings, it can be easy, quick, non-burdensome if it's supported in the whole system. So with all of this, understanding how important this is, how do we as health professionals do? Well, not very well. Healthcare workers have traditionally voted 12 to 23% less than the general population, although in 2020 it looked like we were about even, but that still means about a third of people, health professionals, don't vote. And so estimates are that up to 7 to 8 million healthcare professionals did not vote in 2020. So that's a huge opportunity for us. We were shocked to realize that so many of us are leaving the most powerful tool to improve health that we have on the table. And I also want to emphasize that it's not just the presidential elections or the top of the ticket. Our votes matter in every election up and down the ballot. Getting back to Arizona and heat, in Maricopa County, which is the home of Phoenix, in 2023, there were 645 heat-related deaths, twice what there had been a year before, 10 times what there were a decade ago. And so the community rose up and said, we need some protections. And the Phoenix City Council actually passed a landmark rule requiring heat protection for their outdoor workers, shade, rest, and water. At the same time, in Florida, and this is confusing, the Florida Phoenix is actually a Florida newspaper. In Florida, the legislature, which was voted in an off year when 50% of people did not vote, that legislature banned the ability of cities to pass local heat protections. So our votes matter, and we could be having a much bigger impact just as ourselves, not to mention by educating our patients. So many health organizations see this need and are stepping up, including the American Academy of Pediatrics, which has been really a leader, the American Academy of OBGYN, the American College of Physicians, and civic health groups like VOTE-ER, Healthy Democracy, and Civic Health Alliance launched the We Will Vote call to action, and we'll be talking a lot more about that a little bit later. The Medical Society Consortium also stepped up, along with a number of state affiliates, and developed a Get Out the Vote campaign and resources, which Bob will discuss in more detail. And the Virginia clinicians have taken the ball and run with it. So I'll turn this over now to Bob Kitchen, who is a retired family medicine physician and Air Force veteran living in Fairfax, Virginia. He serves as vice chair for advocacy for the Virginia Clinicians for Climate Action and a member of the Health Action Team for Citizens Climate Lobby. And I'll stop sharing so you can, Bob.
There we go. Well, Cynthia, thank you very much. That was a great lead in describing the importance of voting and relative to its impact on health. As she said, I'm the vice chair for advocacy for Virginia Clinicians for Climate Action. And VCCA was founded in 2017 by Dr. Samantha Adut, who's a pediatrician practicing in Alexandria, Virginia. You can see here on the right side of this picture. We're one of the 25 state affiliates of the consortium, and we represent over 600 health professionals in the Commonwealth of Virginia. First, I need to acknowledge that a good bit of this toolkit that we're presenting is due to what the consortium has done in terms of reaching out and creating their civic engagement resources, tools that allow us to talk to our patients and our colleagues and policymakers relative to what's important to us and how to get people to vote. So this is the first page, one of several of our toolkit, and I need to give a shout out to our communications manager, Ryan Adams, who's just done an incredible job of putting this together, multiple resources, and many that are very helpful in terms of approaching this problem. And Ryan will go ahead at this time and put into the chat the link to our toolkit so that you'll be able to access it and see what's important for you. I've highlighted on some of the pages points that I think are worth expanding on. The first will be something the consortium put out, which was a voting guide for residents and trainees, recognizing that people who are in training often don't have the time to take the steps necessary to get themselves registered and then to vote. And so here we go. This section that the consortium has put together contains sample social media posts so that if you're a residency director or in some other position above your trainees, you can send out messages on their social media. It has templates for email messaging, which you can send out throughout your organization, and also another sample newsletter that insert that you could put into any newsletters that your organization puts out. And another page on another link on this page is the take action or the pledge to vote. And this is something you can present to your colleagues and see if they're willing to go ahead and commit to this. And it has several steps in it, but it will ask them to identify what actions they're going to be taking. Next page is second page. I've highlighted here the vote.org site. And I consider this to be the Swiss Army knife of the tools towards getting people registered to vote. And this is what it looks like for Virginia. Now, every state has its own version of this, but if somebody's not sure if they're registered or not, they can access this part of the site. If they need to register to vote, it will help them do that. If they want to vote by mail, it can set that up for them. If you're interested to see what's on your ballot, this will display the ballot for you. You can get election reminders, and also you can pledge to register. Another page of the resources toolkit has a number of academic studies and articles addressing the importance of healthcare workers voting. There are also videos and webinars that you can view, maybe even borrow, If we have time at the end of the presentation today, VCCA has a video that we put out about 2 years ago. We're currently working to update that to 2024, but it's talking about the importance of addressing the impact of climate change on our people's health and the importance of voting. And then sample social media post. There are a number of these. We'll kind of walk through them, and you're welcome to copy these and put in your own information. I've highlighted what applies to Virginia. Our first day of early voting is this coming Friday. Cynthia has already shown this graph. I made an enlargement of that, but she described it very nicely to us about the importance of more voting access and better health. She also shared with us, again, which is kind of mind-boggling, the number of healthcare professionals did not vote, and such an opportunity we have to get them out. Another social media post about this, the fact that we have a significant number of people don't vote. This one is a notification that the deadline to register is approaching. You can put in your own state's dates for that. This one is how to get a mail-in ballot sent to you. And this one talks about another aspect of early voting. And then this one talks about the final day for early voting. So these could be sent out in sequence through your networks. So that's just a quick walk through our resources toolkit. And I'll wrap up now. I'm happy to take any questions you might have relative to the toolkit. You can put them into the chat, and Karina is going to let me know what questions those are. Thank you.
Nobody put any questions about that in the chat, but if you have some, please do, and then we'll have more opportunity later to answer any questions. But we're, like I wrote, we'll send you all of that, so you don't need to worry. There's a particular link that you're interested in. We'll send you all that info.
I see Margie did ask a question, Margie Chen. Have you been posting this in your newsletter to your members? We actually, our most recent newsletter posted this presentation as the opportunity coming up. And we're going to be rolling out. We've actually looked to see about creating some of our own specific social media messages. And again, a shout out to Ryan Adams, who's going to be overseeing that.
Super, thank you so much, Bob. And then Cynthia, would you like to carry on with the next portion?
Sure, thank you. Bob, that's great. I'm really inspired in thinking about how I can use those social media posts to get out the message. So I hope all of this has inspired everyone to get ready to take some action. So we have 3 simple things that you can do right now related to the We Will Vote call to action. And here in the West Coast, we call this an action hour. I don't know, that's kind of corny, but this is not a webinar, this is an action hour. We're here to actually start taking action. So we're going to ask people to sign the We Will Vote call to action pledge. And it's really a very simple pledge to vote and promote civic engagement with stepped levels, starting with ourselves, then our colleagues, then our institutions, with the ultimate goal of empowering our patients. And we recommend that you start by visiting vote.org. You saw that already. Bob showed you all the wonderful things that the Swiss Army knife has. They build themselves as everything you need to vote. So if you would take just 1 minute now and type vote.org into your browser, that's the website, you'll get to the site where you can check to see if you're registered, or if you know you're not registered, register in just 1 or 2 minutes. But you can also find everything else you need. When is the election? What are the rules? What ID do I need? And it's specific by state. So Dan, can you give me a 1 minute timer to let people do that? And I'm going to tell just a brief story. We did this at our Citizens Climate Lobby meeting, our monthly chapter meeting on Monday, and people thought, oh, we're all registered to vote. We know about this. But I said, humor me, just do it so you're familiar with the site, because you can share this with anyone. This isn't just for health professionals. your friends, your neighbor, your family, encourage everyone to check to see if they're registered at their current address. It's good voter hygiene. And the group chapter leader checked, he's lived at the same place for 20 years. He's voted in every election. He was no longer registered. And that's in California. We know many states are purging voters, and they make a lot of mistakes when they purge. They just willy-nilly get rid of people who have a similar name without looking at initials, without looking at dates of birth. So check to make sure you're registered.
Then you get a little thing. You are registered to vote.
Yeah, and we encourage everyone to do that before October 5th. There are some states that have registration date deadlines out as early as October 5th. So everyone should check their registration, even if you think you're registered. Good voter hygiene. So is that a minute, Dan?
Yep.
Move on to step 2. All right. So then the second step is actually to go to the We Will Vote call to action page. And you can either scan this QR code from your phone or type in the URL address in your browser and get to the We Will Vote call to action. And we'll look at that with the sequential pledge for ourselves, our colleagues, our institutions. So I'm going to go to the next slide, and this is what you should see. And as I said, it's a very simple pledge that says the health of my community hinges on the health of our democracy, and that robust civic participation is required to advance health and racial equity. I understand that the first step starts with me, and I join with my colleagues and institutions across the health sector. And then you can choose what you think you can do. Vote yourself in upcoming elections. You've taken the first step by checking your registration. And then the second step is always to make a plan. When will I vote? Am I going to vote by mail or in person? Am I going to do early voting? How am I going to get there? And making that plan and pledging makes it much more likely that you'll do it. So we encourage you to ask all your friends, family, and relatives to do the same thing. So the second step is to encourage friends, family, or colleagues. But our ask for you today is to get your colleagues to vote, because we saw that this is a huge opportunity and we can then be leaders and influencers. So we have an email to make that easy for you. We have an email template that I'll show you in just a moment that you can send to colleagues. And then later we'll talk about organizations. Oops. Okay. So as the time to the election and registration deadlines are close, we ask that you act now, right now, tonight, and start this process. You can make a copy of this template, which Karina should have posted in the chat, and open an email and just put it in the body of the email. And then we ask you to think of 3 people that you could send this to. And it could be 3 people that you're close colleagues with, or in addition, you could think about colleagues who work on DEI or reproductive freedom or healthcare access. They don't all have to be climate, because all of these things are on the ballot. And those people could help you form the core of a team, a health and equity and civic engagement team, to approach your institution. So think about whether there's somebody across the groups. And also think of anyone who is working with trainees, and maybe you could share the trainee toolkit with them. They'd appreciate that. And lastly, think about anyone you know who is an influencer, maybe in your institution or another hospital or organization. This can be very effective. When one of our colleagues reached out with the subject line, "Hello from Mani, clinical professor at UC, regarding helping our trainees to vote, a proposal for bolstering civic engagement." They were able to reach the vice president of the University of California system, who has agreed to distribute this messaging and the resident and trainee toolkit. So Dan, can you give us a 1-minute timer for this, for people to copy the email template and think about who they might send this with, and try to set a date, commit to a date, preferably this week if you can, but certainly no later than the beginning of next week, to send this out.
And I put in the chat the document that leads you to the template. And I also put the actual template, so whichever thing is easier for you.
Is that the time, Dan?
That's about a minute.
Okay, so hopefully you can continue this on your own if you want, and maybe some of you will share during our discussion section who you're thinking about sending this to. So the next level is to reach out to your organization. And again, we have an email template. Oops. There we go. From you to organizational leadership. And it's very simple. It's asking that they join ahead of National Voter Education Week, which is October 7th through 11th. Join this civic health action, which is supported by the AMA and Healthy People 2030 and hundreds of hospitals across the country. And they could ideally join the We Will Vote organizational pledge. But if there's not time and they want to keep it simple, they can just send an email reminder to staff and employees asking them to check their voter registration and display a voting poster in a central area to encourage patients to be voters for health. And within this, we have this link to the email template that your organization can send out and an editable poster that was developed by Margie Chen and her colleagues at the consortium. So I'm going to show you what this email from organizational leadership looks like. It's simply saying, in recognition of the link between health and voting, we're part of a nonpartisan initiative. We urge you to spare 30 seconds to click here, and that's the link to vote.org, and confirm your voter registration. And if you wanted to have a say in shaping policies, you can also order your free Vote ER badge. So it's very simple, nonpartisan. So again, I would ask you to make a copy of this in an open email and think about,
Oh, sorry.
do you have the body of that in the chat, Karina? So people can copy that? So, yeah, so if you're game to try this, you can also think about an ally who might co-sign this with you. That's why it says name or names, because I have a theory that one person is often seen as insignificant or a quack or a gadfly. But if two people write, it's the start of a movement, and administration is more likely to pay attention. And think about who you would approach, whether it be the communication department, marketing, government relations, human resources, or maybe you know somebody, a department head, chief of staff, somebody like that. Think about who you might approach to start this and work your way up the ladder. And the earliest date that you can commit to doing this, preferably within the next week, because we want to try to get this out by October 7th before registration deadlines have passed. So Dan, again, can we have 1 minute for people to work on this? And while you're doing that, I'm going to put up the beautiful vote poster that we're asking people to display.
All right, there we go. That's about a minute.
All right. Ah, why isn't my slide advancing? Oh, there we go. So I'll close with this, that whatever you care about, health is always on the ballot. And we can improve the health of our patients and our planet through civic engagement in healthcare settings. We can lead the way for our colleagues and institutions, and then expand to patients as well. Now is the time. The planet is telling us that later is too late. And now I'll turn it back to Karina.
Thank you so much, Dr. Mahoney and Dr. Kitchen. Hope that was helpful for everyone and enlightening. If anyone would like to share what you are doing in your state or group, please raise your hand. We'll call on you to speak if you like, or you may type it in the chat, whatever you prefer. I know a lot of you are super active, so if anybody would like to tell us about it. I see your hand, Margie. Margie, do you want to tell us?
Sure, I'm part of the Climate Health Now in California team. And so we have a newsletter twice a month, and every month we have some kind of little article about GOTV. Last time was telling about this webinar as well, but we'll have actions every two weeks until November. We're also having a
What's GOTV?
Get out the vote, sorry. I'm so involved. We also have a 5-year anniversary for Climate Health Now's inception, and at our action hours, we're having these potlucks and meetings throughout the state, and we're having a action hour there. We're doing postcards to swing districts in California and postcards to swing states. So we're going to do this little action hour while we gather and meet each other and connect.
Super nice. California always leading the way. Dan, your hand.
I wanted to mention, so in 3 different states over the past week or so, we've had folks reaching out to about 7 different hospitals now into the institution itself. And the interesting thing, I mean, and one of the interesting aspects of that is in thinking about who to reach out to, it's a lot of the conversation that we had as we thought about that. Well, who's not just only in a leadership position, but has indicated in one shape or another that they would be open to the message, so that there'll be champions. And so in one case, it was the facility director, who's also the real estate director. So he's on the board and a powerful figure in the hospital. And we know, based on the things that he's done, to be a champion. So that's kind of part of the conversation. And if you're not sure about it, reach out to some colleagues who, are like-minded and see what you can come up with. And if you think of 2 or 3 people, fire it off to all of them, maybe create a little social pressure between them, perhaps.
Bruce, were you wanting to show us something? Or was that an accident? We can't hear you.
Sorry, is that better?
Yeah.
Greetings from Southern California. I've been frustrated. I've been worried about this election for at least a year, and I've been frustrated because I live in Southern California. We already know how the vote's going to go in California. So I wanted to be able to reach people outside of, the blue region that I live in. And I was told 6 months ago about an organization called the Environmental Voter Project. I don't know if any of you are familiar with that, but you can look it up online. And what they do is they target non-voting environmentalists in swing states. And there are a number of ways to support this organization. I hosted a fundraiser, virtual one, and then I'm actually writing postcards right now, 200 of them that are going to, again, non-voting environmentalists in Virginia. But I think it's a really great organization. It's data-driven. They use tested methods of social messaging. They create relationships with these people, and they follow their results. They basically do this like a randomized controlled trial where they have control groups and they see how much of an impact they have. And they've been doing this for 10 years. So I think Environmental Voter Project is an organization that you can put on your radar. because aside from donating money, there are other ways to contribute and to participate with them. And it reduces my anxiety and increases my confidence to think that I'm potentially going to have an impact beyond the blue bubble that I live in. So that's
Well,
that's what I'm
California isn't all blue, but
That's
that's
true.
super important. All targeting people who we know would cast a vote for health, who don't usually vote. That's a super effective, I think, strategy. Bruce, do you want to tell us? Oh, Margie has your hand. Just quickly about the other things you do with your patients and Climate RX and Eco America, or?
Yeah, I left my practice in 2013. I don't see patients anymore. I'm basically a full-time climate activist, but working with Eco America, the Climate for Health program. I'm a fellow there, and we've created this 4-hour training, which gets doctors up to speed on the links between climate and health, and then also does advocacy training. And I think a number of the people on this call are familiar with the program. It's a powerful, ongoing resource for people. It doesn't cost any money at all, and doctors can take it, and anybody in healthcare can take this training at any time. It's available on demand on the Eco America Climate for Health website. So that's something that we are really proud to have being shared. And we're getting it into some rather major health plans like Kaiser Permanente through Seema Wadwa's leadership. It's now available to Kaiser doctors everywhere. So we're making progress.
Thank you. Jamie, say how you say your last name, Duvernay, or I don't know.
Sorry, it took me a second to get my camera off. Duvernay. Bruce, that's super inspiring, and I'm super excited about all the stuff that you're doing and everybody else that's shared as well. I love all the stories. Thank you guys so much for sharing and providing this information tonight. I have been a healthcare professional for 18 years and recently graduated in public health, but my biggest passions are all environment, climate, and things like that. So I'm tired of sitting on the sidelines and ready to get to action. So I'm actually engaged in our local organization, Michigan Clinicians for Climate Action, and part of the Get Out the Vote. So this is new territory for me, which is a little intimidating, but I'm super inspired by all of you who are already doing this work and all the tools and resources provided. I actually have plans, and I'm drafting, in the middle of drafting my email to my college that I graduated with, my MPH, specifically to reach out to students, but also to see if they could maybe take on encouraging other students, because young people in general are not likely to vote as much as well. So granted, those who are educated are more likely, but that's kind of one population I'm looking to reach out to. But also I work for a huge healthcare organization in West Michigan, and we have a lot of equity goals, and we have a lot of climate goals within our organization. So I'm actually hoping to reach out to a couple different leaders, and then we actually have an engaged, they call it business resource groups. It's basically an engaged team members that work with leadership to drive sustainability and things like that. And there's a brand new one that's Planet Health. So I'm actually hoping to connect with them and consider figuring out how we can get some of this up the chain to the sustainability and climate lens of things, but also reach down to our programs that are out in the community working with individuals who are impacted, not only by climate, but just health disparities in general. So that's kind of my few things I'm trying to do with the Get Out the Vote campaign and connections to health. So pretty excited about it. I'm hoping people will take to it, but I'm also knowing that rejection might occur. So
That's okay. That's super inspiring. You are yourself with all of those things and ambitions. And rejection is part of it, but at least, like Cynthia said earlier, it gets it on people's radar and gets the ideas out. And you plant seeds, you make ripples, and then at some point that turns into a big wave. So we know your super great colleague Lisa Del Buono, who I'm sure you'll be working with, and all of your other colleagues in Michigan. So That is exciting. Who else? Margie, you've had your hand up, I think, a little while.
I was going to make a segue from Bruce's comment about the EVP Environmental Voter Project. They are really targeting young voters as well now, who are, again, the young voters are very low propensity voters. And so it's really targeting those climate concerned young people. So that's a really great audience to look for. And then also for our trainees and anybody who's associated with any training program or teaching or academic program, really reach out to your to use the training toolkit to get the low-hanging fruit. These are residents and our medical students and our fellows who move all the time and who are too busy to vote, to just have them consider a ballot, mail-in ballot, and to make sure they're registered in their current location. So really pushing the trainee toolkit for that's low-hanging fruit, I feel like.
Super. Dan.
I was just going to piggyback on a few different comments, a bunch of different things, but just the general sense of you raised, Jamie, the point of, it's you put yourself in some positions of discomfort and all of this, including, we were talking about before, sending out emails or contacting people. But the flip side of that is most of the time people respond, even if they don't. They appreciate that you made the outreach is what happens 90% of the time, and maybe 10% of the time something else happens. And then there's also times where people say, thank you so much. I've been thinking about this. I didn't know what to do. So there's that kind of positive aspect. And also this interaction that Margie talked about, the interaction between older folks and youth, like, the residents and trainees, seeing us, I'm in a more elder part of this, the fact that elders are stepping up and doing things, and to be clear, to try to make sure young folks know about that, it's hugely empowering to them. And the last part is, I always think about it when I'm on a call like this. So I see all these people on this call. There's a bunch of people all over the country who every day get together in ways like this and try to make progress forward. And it's hugely empowering and it's fun. You leave this call like this, you say, I'm fired up. And many of us on this call do this stuff every day, but I still get fired up on every call. And if we can relay that to others, and so they can get a sense of it and they come in and they see, then it builds on itself, and it goes back, Jamie, to what you're saying. Then you're even a little bit more willing to take some risk because you see others doing it and you see some productive stuff. So yeah.
And just to add, thank you, Dan, to the elders comment. I think also elders get blamed for the mess that we're in. So the people who are not elder like to see that even more, that we're taking responsibility and trying to change things, improve things. Yeah. Yeah, exactly. Make sure to have fun. You can say it, Cynthia. Does anyone else want to say anything or share anything? We're 5 minutes away, from the hour, which we can, we were gonna share also our contact info, all this stuff, if you want to show Cynthia, maybe the last slide with our info, but we'll send you all that info anyway, if you wanted to contact us later. Yeah, we'll get all this more inspired in the morning. Yeah, it's a bit late. Yeah, we'll send all of the links and all of the info so that you'll have it. Morning people, and even probably a long day of hard work. So thank you everybody for your hard work and for joining. We're so glad that you joined, and thank you for your attention and participation. We hope you agree that our voices and votes matter, and that part of our role as health professionals is to be civically engaged, that we can encourage our colleagues to do so as well, and that nonpartisan health sector civic engagement and voting is the prescription we need to protect our health and a life-sustaining planet, which we're hoping to keep. So any last words of anybody before we say goodbye? Okay. Thank you so much. So look out for our email.
Thank you.
Bye-bye.
Bye-bye, be well.